This lesson is about radiation health risk. Medical imaging actually includes several sources of ionizing radiation that is potentially harmful to workers, patients, and the public. Radiography, fluoroscopy, C-arms, computed tomography, as well as nuclear medicine all use ionizing radiation. So what are the health risks associated with exposure to radiation? The most important health risk is cancer. The risk of cancer is based on the linear non-threshold model, which predicts that any increase in a radiation dose increases a person's risk of acquiring a radiation-induced cancer. So more radiation exposure results in an increased risk of cancer. This is true for patients that are directly exposed to radiation, as well as staff that are indirectly exposed by scatter radiation. Fortunately, diagnostic imaging procedures result in relatively small radiation doses to patients and staff, so the risk is also relatively small. Also understand that cancer is called a stochastic effect, which means that whether or not it occurs is completely based in chance. Each radiation exposure increases the risk, but it's never guaranteed that a radiation exposure will cause a cancer. That's why it's important to keep radiation dose as low as reasonably achievable. Any dose increases the risk or chance of cancer. Genetic conditions are also a stochastic effect like cancer. When radiation interacts with the germ cells of males and females, it is possible for damaged DNA to be passed on to future generations. Fortunately, the risk of this occurring can be minimized by reducing the dose. Decreasing radiation dose decreases the risk. So cancer and genetic conditions can be caused by any dose of radiation, but there's another class of effects called deterministic effects that are completely different. These occur only at specific dose thresholds and not before. Here's a few examples. Temporary sterility requires an acute exposure of at least 500 milligray. In order for skin erythema to occur, this requires an acute radiation exposure of at least 2,000 milligray. And hair loss requires an acute radiation exposure of at least 3,000 milligray. When proper exposure techniques are used, these doses are hundreds or even thousands of times higher than the doses experienced by patients and workers in radiology. On very rare occasions, patients undergoing interventional fluoroscopy procedures and cardiac catheterization may experience doses above these thresholds. In those cases, skin injuries are the most commonly observed effects. It's also important to know that not all patients and procedures are associated with the same risk. Variables that affect a person's radiosensitivity include the person's age, the tissue type, and the exposure frequency. Concerning patient age, children are significantly more sensitive to radiation than adults. Radiation dose that's harmless to an adult might be quite damaging to a child. So it's important that all technical factors in a radiological procedure are adjusted to the size of the child. Children are more sensitive to radiation and therefore should receive a significantly lower dose. Some tissue types are also especially sensitive to radiation. The breast, gonads, thyroid, lungs, and the bone marrow are the tissues most likely to develop cancer from a radiation exposure. And this is really important to keep in mind when shielding patients. For example, if you're performing a chest X-ray, make sure and shield the abdomen and pelvis to reduce the dose to the gonads. If you're performing an X-ray of the extremity, make sure and shield the patient's abdomen and chest as well as the thyroid. And if you're standing in the room during an exposure, shield yourself for the same reasons. Exposure to the sensitive organs should always be minimized. The last variable that influences the risk of radiation exposure is the exposure frequency. It's a simple relationship. More frequent exposures are more harmful and the risk increases. Here's an example. Which person is at greater risk of acquiring a radiation-induced cancer? A worker that acquires a radiation dose over several months, called a chronic exposure, or a worker that acquires the same dose during one procedure. That would be called an acute exposure. In this case, it's the second person that's at greater risk because more frequent exposures are more harmful. The second person has received their dose more quickly, so they're at greater risk. In summary, remember that radiation effects can be categorized as stochastic, like cancer and genetic diseases, but they can also be categorized as deterministic, like sterility and skin injuries. Finally, remember that some situations create more risk than others. The most sensitive people are children. The most sensitive organs are the breast, the gonads, the lungs, the thyroid, and the bone marrow. And finally, keep in mind that more frequent exposures are more harmful than infrequent exposures.